We're happy to be joined now by Dr. Charles Emlet, who is a panelist here for a session about the population of Americans over 50 living with HIV and AIDS. Welcome.
Good morning.
We want to talk about this population first. How large is this population?
There are about 1.1 million people in the U.S. living with HIV, and right now somewhere around 50% are over the age of 50. So we're approaching about 500,000 people. And
that population has been growing, I understand, over the last few years. Why is that?
Well, it's really a confluence of two phenomenon. One is that about 17% of all new HIV diagnoses every year are in people over 50. So they represent a portion of new diagnosis. That said, that people are living longer. They're living, almost natural length lives, and so there's a phenomenon of people that are long-term survivors and growing older. And so these are really two different populations, but they converge to create this rapid growth.
What are some of the current challenges that this population is facing?
Oh, there's so many. There's medical management of the HIV disease that gets superimposed with chronic diseases of older adulthood. You've got a lot of psychosocial issues such as depression, HIV-related stigma, social isolation.
Many things, many challenges, and we also, I think, wanted to mention the diagnosis of these people. It's a challenge actually for them to be diagnosed.
Yes, a lot of the symptoms, early symptoms of HIV disease are confused for other things because there's low clinical suspicion. Medical providers don't think HIV, and neither do many of the older adults. So some of the symptoms they have around malaise or fatigue or somewhat vague symptoms are not thought of as possibly HIV. The result of that is that there's about 35% of older adults diagnosed with HIV receive what's called a late diagnosis. That means that clinically, they're advanced clinically. The HIV is advanced clinically, and they're much closer to an AIDS diagnosis.
And it could have been easier to treat them if they were diagnosed earlier.
Earlier treatment is always better.
Let's talk about some of the successful implementation strategies that you've seen in helping this population.
I think one of the most important issues, especially psychosocially, is surrounding people with support. And we know from the research that social support is key and keeping people connected. The systems are not well connected. The HIV system and the older adult, kind of older American Act system are not well connected. And so some of the really successful models around the US, GMHC in New York City, some work that's being done in San Francisco, works to integrate HIV care and care for older adults.
We're seeing some of those when the groups work together in a better way, that the strategies work better.
Yes, but they don't work. It's rare that they work together.
Okay.
It's really in HIV epicenters, large cities, that those systems work together. I think that's one of the most important things to consider, is that this is an incredibly diverse population. So they're diverse in terms of gender identity, sexual orientation, race, ethnicity, the way in which they were infected with HIV. It's this intersectionality of often populations that are disenfranchised. And so you can't necessarily compare a 65-year-old heterosexual woman's experience with a 50-year-old gay man.
What do you think your peers need to know about improving the lives of these people in this population?
I think the biggest takeaway is don't make assumptions. See people as individuals, recognize their diversity, and find ways to coordinate and get those systems to talk to each other. And that's probably one of the most important things.
Dr. Emlet, thank you so much for all of this good information.
Great, thank you.